I called my dermatologist, and I was told by his receptionist that because I hadn't seen the doctor within the last 12 months, that I would be required to either get a referral letter from my family doctor, or to pay $125 to make an appointment to see the specialist. I informed the receptionist that I didn't have a family doctor, so I couldn't get a referral letter, and secondly that I was pretty sure that the $125 fee he was asking was illegal. Now, Mr. Speaker, I can probably afford the $125, but I am concerned about the almost 1 million Ontarians that don't have a family doctor, can't legitimately get a referral letter, and are being asked to produce their credit card number in order to make an appointment with a doctor in this province. Minister, do you think this is right? Do you think this is fair? And is this what your government calls open access to OHIP services?
Minister.
Well, the facts are these, Speaker, that under my friend as a previous health minister in this province, we saw a significant reduction in health services in Ontario. In fact, through the work of Premier McGuinty and through our colleagues here in the legislature, we've been able to enhance health care services. I find it remarkable that this member and his party, who advocate a $3 billion cut to health care, would even deem to ask this question. But, Speaker, as far as doctors, there are over 1,200 more doctors practicing in Ontario today than in 2003. In fact, Speaker, with the advent of family health teams, 150 of which have been implemented in the province, we are seeing over 600,000 additional Ontarians have access to frontline medical care to be able to have that access to a primary care physician. Speaker, there's more. We're enhancing and expanding the number of medical...
Supplementary.
That is a horrible, horrible answer. I'm asking this question on behalf of the million Ontarians that don't have a family doctor, that are being asked to produce their credit cards and produce $125. What about the lady on fixed income in Beaton in my riding who can't afford the $125? No one under the Mike Harris government or Ernie East government was ever asked to produce their credit card to see a doctor in this province. That is absolutely shameful. You did not answer my question. I want you to report back to this House. How often is this happening? I talked to the CPSO this morning, and they said they're getting complaints all the time and that your government's doing nothing about it. I gave your ministry a chance 4 weeks ago to give me an explanation. They never gave me an explanation. You should be ashamed that you're blocking OHIP services to people on fixed income, to 1 million Ontarians without a doctor. Shame on you!
Order. Order on both sides. Order. Minister.
Speaker, thank you very much. I'm happy, of course, to look into specific examples, but I would remind the member that he brought a similar kind of passion when he closed 28 hospitals right across the province of Ontario, when they fired thousands of nurses that saw it at the roots of many of the challenges that we have today, that saw, in fact, this member vote against two-tier medicine and ending those practices when we introduced the Commitment to the Future of Medicare Act. Speaker, here's the reality of the situation that we face today. We've introduced family health teams which have expanded the number of practitioners and expanded the number of Ontarians who have access to frontline medical services. We are introducing nurse practitioner-led clinics, another innovation which is going to give and provide Ontarians with that kind of access. In our new agreement with the Ontario Medical Association, collaboratively working with Ontario's physicians, we are finding ways that another...
Thank you. New question, the member from Hamilton Centre.
Thank you, Speaker. This is to the Minister of Municipal Affairs. The fiscal review is